it is 7:00 p.m. Eastern time here in Boston, so we will get started. For today, this is our hip and knee pain program. It's a 30-minute movement-based program. We will do some stretching and some strengthening as we work through today's class. And I always offer a number of modifications as ways to continue to progress or regress the exercises to make them appropriate for your body, because I know everyone coming into this class is dealing with something slightly different when it comes to their hip and knee. So please listen to your body. That way you'll get the most out of this class. I know most of you here, but I know we have a couple new people. So for those of you who don't know me, my name is Allie. I am a doctor of physical therapy as well as a nationally certified Pilates instructor. I founded the Pilates RX here in Boston, which is where I practice full time. And then I teach with the Community Online Academy on Thursdays. So we're going to get started for today's class, like I said, up and standing. So if you do have your cameras on, you can orient them up to that standing position. And we're just going to warm up the tissue of our hips and knees. I just want to make sure that you guys have a good view here. Let me make one quick camera adjustment. Okay. All right, so when you come to your comfortable standing position, first thing first, I want you to look down at your feet. So oftentimes our feet, they kind of tell us a little bit about our most comfortable hip position. So think about lining up your feet parallel. They may not be that way to start, but I want you to line them up parallel to one another. Sometimes it can be a little confusing based on what our big toe looks like. Your parallel alignment comes actually from your second toe. So your second toe should point straight ahead on both of your feet. From here, bring your hands to your hips so you can feel your hips are about level when you begin. Keeping that position, we're just going to start to march one knee up towards our chest at a time. So like you're pulling your knee in towards your chest, but notice I'm not slumping forward. I'm keeping my chest tall, just drawing my knee towards my chest without otherwise moving the spine. So this might start off feeling a little bit pinchy, a little bit tender and sore. That's okay. I want you to work within your body's comfortable range of motion. We're going to do some mobility work for this here in just a moment, but all I wanted to do was warm up the tissue, which makes our stretching more effective. Good. Now from here, I'm going to turn to the side so you guys can see. I'm going to just tip this down a tiny bit. We're going to start doing some little kicks towards our bottom. So now kick the heel towards your bottom. Okay, this can be small. Notice that I'm also not leaning back. I'm trying to stand up nice and tall. It may even help you to keep your hands right on your trunk so you can kind of feel that your kick backwards is not disrupting the rest of your body. It really is just a knee movement. That's it. Good. We have 4 more. 3, 2. Last time. Final move in standing. We're going to kick the leg side to side. So I'll shift the camera here so you guys can see more of my feet as we kick side to side, side to side. Good. Now, if you feel pretty strong, pretty confident, you can add a reach of your arm overhead. So step and reach, and reach. Good. Now this is optional. You can just do the kick of your legs with your hands on your hips, especially if you have any shoulder discomfort. But same arm, same leg, reaching as though you're creating a star position with your body. So just continuing to work to warm up all of our joints before we get into some of that deeper stretching here. Good. 4 more. 3, 2, 1 more time. Now, land with the feet back in that parallel alignment. We're going to go ahead and take this into a true calf movement. So we talk about our hips and our knees, but our knees are controlled by what happens at our feet. So in that parallel alignment, I want you to slowly start lifting and lowering up and down on your toes. Now notice a couple things, especially if you have your own camera on and you can see. Notice if your knees are buckling. They shouldn't, right? This is an ankle movement. We want our knees to be nice and still. Notice if your heels are kind of spinning out or spinning in. try and keep your heels directly in line with that second toe so your feet stay parallel. This can get pretty tricky pretty fast, okay? Notice how it takes a lot of work to slowly lower down, almost just as much as it does to lift up. Now we start here with the ankles because these are our shock absorbers for our knee and for our hips. So if we're feeling really weak and tired or wobbly in these muscles, you guys can think about how that starts to add stress to our knees and our hips when we're walking and certainly running and going up and down stairs. We're going to do 5 more here. And 4. We're going to stretch these out. Don't worry. 3 and 2. Last time, lower down. Good. Now, to come into our stretch, you're going to step your right foot forward, your left foot backwards. Now, my left heel is going to push all the way to the floor. If this feels like a stretch already, great. You're going to stay here like this. If it doesn't, bend your right knee so that you can continue to push the left heel away from you. And this should be active. I am pushing my right foot forward and my left foot backwards. Now, I know you guys can't see that, but it's as though I am spreading my mat apart, and that should feel like a nice stretch through the back of your left ankle. You may even feel that stretch all the way up to the back of your left knee as well. So if you're someone who tends to have some pain or soreness in the back of your knee, this may be one of the culprits. Good. Okay, and let's go ahead and switch. So this time our left foot goes forward, right foot goes back, step your right heel down, and then if you need a deeper stretch, start to bend your left knee. Both of your toes should be pointing forward, and if you feel really wobbly here, please don't be afraid to grab onto something for a little bit of balance support. So I want you to be able to relax into this stretch, and if it's easier to do so with some balance, don't be afraid to grab that here and now. Good. Push the left foot forward, the right foot backwards as though you're spreading and splitting that mat open. We'll hold and breathe. That's it. We go for 4, 3, 2, and 1. Come all the way in. Okay, now we're going to find ourselves back down onto the mat, but this is a great little test. I think if you guys took my class last time, we tried this as well. See if you can come all the way down and place your bottom onto the mat from a squat. It's really tricky. It takes a lot of ankle mobility, knee mobility, and hip mobility. So if that was hard for you, that's okay. That's what we're here for. That's what we're going to work on. But that's a good little test to look at your range of motion in squatting. So from here now, we're going to lie all the way down onto our back. Okay? And then you can step your heels in nice and close towards your fingertips. Okay, so first exercise we're going to do is a strengthener for the back of our hips. It's also a stretch for the front of the hip. So one of the most common muscles that tends to be tight in our body is that hip flexor. So right on the front of our hip, it affects our knee pain. It also can actually affect your back and back pain here. So with your arms down by your side, push equally into both of your feet and lift your hips up into a bridge. From here, bring your hands to your butt muscles. Your hips, glutes should be what's doing the work here. If you don't feel them working, see if you can activate them in this position. Soften the space between your ribs and hips, and that should actually help you to feel a little bit more work in your glutes. Now, if you're working to find that, stay here and just hold it. Otherwise, you can lower your hips down, tap the mat, and lift and press the hips on up. Lower down and tap, and press and lift the hips on up. So this is a nice exercise to balance out our hips. We tend to be really dominant with the muscles on the front side of our legs and kind of weak and lazy with the muscles on the back side of our legs. And so that imbalance over time can lead to more stress on some of the tissues in our hips. By building up some strength in the back side of our legs, we can really start to work and balance our regular movement patterns. Good, so nice and slow and steady. Now, as we're lifting and lowering here, I want you guys to notice if you feel one side doing more work than the other. If maybe one hip is a little bit more wobbly than the other, can you make this nice and smooth? Both hips lifting and lowering gently as you press the feet down into the floor and lift the hips up to the ceiling. You may also start to feel that nice stretch and opening across the front side of your thighs. Good, we have 5 more. That's it. Lift up for 4 and 3. Good, last 2. Last time, drop it down and take a little rest. Now, from here, we'll take this into a little stretch of both the glutes and our knee in towards our chest. So you can hug behind the right knee and gently pull the knee in towards the chest. That should feel good against the glute that we just worked. If you feel any pinching in the front of your hip, I want you to hold your hands and actually push your leg into your hands and just hold that for a moment and then try and pull the knee back in. That should actually help relieve some of that pinching feeling and allow you to get a slightly deeper stretch here. We'll hold for just another breath and then gently release that leg down. We're gonna do the same thing on the left side. So bring the hands behind your left thigh, start to gently pull the knee in towards your chest. And this is gentle. It should not be painful. It should just be a light stretch. If you're feeling that pinching in the front of your hip, you're gonna push the back of your left thigh into your hands, really push hard, and then release that and allow the knee to come in. And that pinching feeling should be a little bit better. You can repeat that if that pinching persists, but maybe is a little bit less. And then just add that soft, gentle stretch in. Good. We're gonna try one more time here, just like that. And then place it down. Good. Now, we talked about that hip flexor muscle, how it's often quite tight. So when we think about muscles and why they get super tight in our body, often the root cause of that is weakness. So the muscles tighten up in response to our body sensing weakness as a way to protect itself. So we're going to actually do some strengthening work next for our hip flexor. So go ahead and straighten your right leg. You're going to flex your toes. So point your toes up to the ceiling. If when you flex your foot, you notice your toes are pointing off to the side, turn them up to the ceiling. That should also mean that your kneecap is pointing right up to the ceiling. Now, from this position, I want you to tighten up your knee. So imagine like you're pressing the back of your knee down into the floor. Holding that tight, you're going to lift the right leg up a few inches and down a few inches. Super small. Smaller here is better, okay? You don't have to make this a big movement. In fact, I really want this to be a small movement. Now, if you feel this in your back, just means you need to engage your core a little bit more. So try exhaling and then lifting the leg and lowering back down. Again, exhale, lift, and lower it back down. Now, if you're feeling this in your knee, chances are your knee is bending a little bit. Even if you don't quite feel that, I want you to try and work super, super slow. Keep that knee really straight as you lift up and slowly, gently lower it back down, then let the leg relax. Straighten, lift, and slowly lower. And this is called a straight leg raise for a reason. And you guys can feel how this actually gets quite fatiguing, quite tiring, done well pretty quickly. We'll do 3 more on this right side. Slowly lower it back down. Good. Last 2. Gently lower down. One more time there. And go ahead and lower it down. You can bend the right knee in. Allow your legs to gently rock from side to side, just windshield wipering out to your low back. And then we'll allow the knees to settle right in the middle. Kneecaps point up towards the ceiling. We're going to do the same on the left. You can straighten your left leg, flex your foot, make sure your toes, you can even look down, are pointing right up to the ceiling. That means your kneecap is also pointing up to the ceiling. We're going to exhale to engage our core, press the back of the knee down into the mat, and then lift in a hover, lower back down. We tighten the knee, we lift and lower. So super small range of motion here. As you're working, you might find that your knee is also starting to spin out to the side. Work to keep that kneecap pointing straight up to the ceiling. You can even push down into your left foot for a little bit of extra support. Now, again, for those of you who have knee pain, that's kind of right on the front of your knee or maybe down by your patellar tendon. This is a really, really good, important exercise to build up more strength and stability through your hip flexor. Good. 4 more. That's it. Exhale, lift 3. Good, guys. Last 2. One more time here. Go ahead and bend the knee and then separate your feet wider than hip distance. Now, from this position, we're going to do that same side to side rock. With our legs wider, that's going to actually allow us to rotate our hip joint a little bit more. So here, if you're feeling tension or tightness, this is related to your hips, internal and external rotation. Okay, so depending on your own hips, everybody's range is slightly different. It's just something for you to notice here. We'll do a few more. That's it. And last time here. And then settle into the middle. From here, we're going to roll onto our side. So I'll lie on my left side first if you guys would like to follow me. What we'll do is kind of line up the back edge of your spine with the back edge of the mat. And then you're going to bend your knees to a little less than a 90-degree angle and bring your heels in line with the back edge of the mat as well. We're going to try here what's called a clamshell. So clamshell is to strengthen the external rotators of the hip. That is what supports our leg from collapsing in when we do things like squatting. So if you're someone who's had an injury to the inside part of their knee, or perhaps your ACL, your MCL, these are really, really important for you. So I want you to think about first the space between your right rib and hip. Lengthen that space by pushing your right hip away from your body. Once you have that, that means your core is now set in a neutral position, which is what we need for these muscles to fire. Keep your heels together and start to lift and lower that top leg. Now, this should be slow. And if you're wondering kind of what muscles should be working, if you could imagine that a muscle that kind of rests right along the top of your back pocket of your jeans, that's what we're working here. It's your glute medius. And so this muscle is pretty small, but works a lot to help build balance and stability. So I want you guys to work slow, not only on the way up, but on the way down too. If you're feeling this more pinching in the front of your hip, it's probably because this space is too small. So you want to reach your hip down in a way, and then try pinching and hugging your heels together when you lift, as though there is a really important document between your heels. And that should help you to feel it more on the outside of your hip. The other thing is that your hips may be rolled too far forward. So you may need to roll back. A good way to check is if your hand is up on your hip, your elbow should point straight up to the ceiling, not forward. Okay, good. 5 more. That's it. 4 and 3. Last 2. Last time. Now reach and hold that leg out straight. Hold it there. Now, again, I want you to think about your kneecap. Look at your kneecap and see if it's pointing down towards the floor. That's that same stress to the inside part of your knee. So see if you can turn your kneecap to point straight ahead. Keep that space between your right rib and hip open, and then just gently start to lift and lower. Super, super small range of motion. Notice I'm not letting my right leg come down to the floor at all. I'm just lowering to the height of my right hip and then back down. Good. I know this is tiring and fatiguing for your hip. If you're feeling any pinching pain in your hip, it's probably because you're too low or too high. So keep it in this tiny, tiny range just above your hip joint. 4 more and 3. You guys are almost done here. Last 2 and last time. Come all the way down. Excellent. Now we are going to stretch that out, but we're going to do the other side first. So I want you guys to just flip over. I'm going to turn so that I can continue to see you here. So we're going to line up our spine, this time laying on our right side with the back edge of our mat, bending the knees to a little less than a 90-degree angle with your heels in line with the back edge of your mat. And then think about that space between your left rib and hip. lengthen that space away, keep your heels together, and start to lift and lower from there. Draw your front rib cage in, keep lengthening and lifting through the top of the head. Good, keep the heels hugging together. Gently lift and lower. Good. Again, if you're feeling that pinching in the front of the hip, notice if your hip is rolled too far forward, or perhaps the space between your left rib and hip is collapsed. That lengthening is really important to keep what we would call a level pelvis. Good. Hug through the heels and slow as you lower the leg back down. You guys have got this. 5 more. And 4. Last 3, we'll get ready for that straight leg hold in 2. And one more time. Now reach that left leg out straight and hold it there. Notice again, if your kneecap is pointing down towards the floor, can you shine your kneecap straight ahead? Reach the left leg out long past the end of your body and start to lift and lower in that small range of motion. Now we focus a lot on these sideways movements for hip and knee pain because so much of what we do is front to back. We don't do a lot of sideways movement in our day-to-day life. But the hip joint is a ball and socket joint. That's a circular joint, meaning it can move in all directions. And so if we imbalance our body by doing lots of front to back without a lot of side to side, that's where things start to break down. So these sideways strength movements are super important to balancing your hip mobility. Good. You guys have got this. We go for 4 more and 3. Last 2. Last time, come all the way down. Excellent. So you can roll onto your back. And we'll take that into a stretch. So allow your head to rest down. You're going to take the left ankle on top of your right knee. And then from here, you may already feel a stretch in the outside of your left hip. If you do, just stay here. If you don't, you're going to grab the back of your right thigh. Now, when you do that, if you lift your whole tailbone off the mat, that's too much. That means it's becoming a back stretch and no longer a hip stretch. So you want your tailbone to stay down. And as I say with all stretches, this should start off gentle. If it feels like your body is stressing or straining to get in this position, you're not going to get a very good stretch because your muscles are going to start to guard and actually tighten up in response to that stress. So you really want to let your body kind of relax and let it go. Now, as you lie here, if you would like to build on this stretch gently, you're going to take your left hand to your left knee and push very gently away. If that becomes stressful on your knee, I want you to back off. This should just feel like a slightly deeper stretch in the left hip. And we'll just hold and breathe in that position. Good. And we'll try one more big breath in here. And then place your right foot down if it was lifted. But we've got one more thing. You're going to take both hands to the left knee and pull it across towards your right shoulder. Now, again, if you notice your left hip lifting off the mat, we want it to stay on the mat. That's a great back stretch. And I promise you, we do that in my back class, but we're trying to target our hip here. So you want your hip to stay down on the mat as you gently pull the knee across your body. If it feels really pinchy in the front of your hip, just bring your leg down a little bit lower as though you're pulling it across to your hip instead of your shoulder. We'll try one more breath here. And then you can go ahead and place the left foot down, and we'll go to that right side. So you're going to cross the right ankle on top of the left thigh. This may be enough of a stretch for your right hip, in which case you're just going to stay here. If you want to deepen that stretch, you can hold the back of your left thigh and gently pull in, but only enough that you can keep your tailbone on the mat. So not curled up or pressing the tailbone down. And that should actually make it a deeper stretch for your hip to keep the tailbone down. Let your body kind of relax and melt into the mat here. And then if you would like to deepen this a bit further, take the right hand onto the right knee, very gently start to press the knee away from your body. Tailbone is down, shoulders are relaxed, the jaw is released. Good, and try another breath in here. And a breath out. Our final stretch in this plane will be to take the right knee over towards the left shoulder. And we do all these different planes because, again, that ball and socket joint of our hip, it means that we have muscle fibers that go in all different directions around our hip. So to really stretch each one of them, it takes a couple different ranges of motion. Good. Again, if you get that pinching in the hip, you can pull your right knee over towards the left hip instead of the left shoulder. We'll try one more breath there. Good, and then place both feet down. Now, we have a little core challenge to come up into our seated position. So stretch your legs out long. Our core does contribute tremendously to our ability of our hip and knee to be stable. So we'll try this here. We're gonna reach our arms long overhead, fingertips come up to the ceiling, curl and roll all the way up to a seated position. Now we're going to take this into a gentle hamstring stretch on the back of the thighs. If you have a history of sciatica, I want you to bend your knees, or really any sort of back irritation right now, keep a bend to your knees. I promise you, you will still get a good stretch. So pick your chest up nice and tall, keeping your back relatively flat. We're going to tip and hinge the back forward until you feel a stretch in the back of the thighs. The stretch does not need to go into your calves. This position really shouldn't be a huge calf stretch. And if you feel that mostly here, bend your knees and then allow yourself to tip forward so that stretch is focused to the hamstrings. You can rest your hands on the floor next to you or on your shins. If your legs are straight, you can allow yourself to gently reach forward towards your toes, but trying not to super compress the spine. So we're keeping a relatively lifted, flat back. Continue to grow taller through the top of the head. Take another big inhale, breath in, and another exhale, breath out. Just a little bit closer there. One more inhale, breath in, and an exhale, breath out. And then we're going to bend the knees and gently come over to an all fours position. So our final stretch here will be for the knees. And if you need a little bit of padding for your knees, go ahead and roll up your mat a couple of times. We're going to use this all fours position to both stretch into knee bending as well as to do a little bit of core work. So we start with our hands under our shoulders, knees under our hips. We're going to keep our flat back position. So imagine like you have a glass of water on your low back. Go ahead and push your hips backwards, keeping your back flat, bending your knees as much as you can, and then you're going to shift forward, dropping the hips down into a plank position. Hips come back, the back stays flat, and then you shift forward, coming into that modified plank. So we're just working in and out of this position, just allowing our knees to get a gentle stretch into bending. This is also a nice stretch for our ankles in the other direction, so the top of our foot, which is something we don't think about a lot, but people tend to be kind of tight in those muscles because we sit with our feet flat on the floor for most of the day. We don't sit with our feet necessarily tucked under, although I do choose to sit that way from time to time. So if you do, kudos, and you probably have pretty good range of motion here. That's it, guys. We'll try 4 more. Shift forward, that's it, last 3. And shift forward for 2. And 1 more time there, shift forward, and then come to a comfortable seat. So that concludes the movement-based part of our program. And I know we worked through a bunch of different things, the hip and knee joint, and really kind of it's difficult to ignore what's happening at the ankle are super complex. So more to come, but I hope you guys have a better understanding of some of the basics of why certain movements might contribute to knee pain or hip pain and where some of your body's weaknesses are. So you can go ahead and target them to make a program that's more custom to your body. So we'll spend our last, I know we're already pretty much at the end of our time, but we'll spend a couple of minutes going over any questions.